Everybody is talking about these medications. Ozempic, Mounjaro, Wegovy.
We don't really think of them as weight loss drugs anymore.
There's a lot of positive effects on the skin.
Really important benefits for many different diseases. Skin, joint, potentially in the future, Alzheimer's disease.
It's a really exciting advancement for us as dermatologists.
Unmask their genes for male or female pattern hair loss.
Every medication that anyone ingests ever has a side effect. What people notice.
Some of the more serious side effects can be
Ozempic, Mounjaro, Wegovy. Everybody is talking about these medications, and mainly it's for weight loss and diabetes. But there's a lot of positive effects on skin conditions, and we're going to take a deep dive today so you can understand both the positive and the negative sides of these.
And not everyone needs these medications. We know that nothing replaces a healthy diet and good exercise, but for many skin conditions, understanding that they form part of a metabolic condition is really important. And that's what we'll be discussing today.
Hey, Ryan. Today, we are going to talk about a topic that is virtually ubiquitous. Today, you are seeing it in Hollywood, you are seeing it in Australia, you are seeing it in every kind of facet of social media, and that is the GLP-1s.
Absolutely. Sam, I don't think many medications have captured the hearts and minds of everyone, doctors, nurses, physiotherapists, the community, as much as this class of drugs. And I think it's really important that we provide really good education about what they are and what they're not, and why we care about them as dermatologists.
I absolutely agree with you. I think the overwhelming thing that the public knows about them is they're used for weight loss medications and diabetes primarily, but the longer they're around, the more health benefits they have been shown to have. Would you agree with that?
Totally. And I think what we will find, Sam, is that we don't really think of them as weight loss drugs anymore. I think these class of medications, which are not new, are really going to be shown to have good metabolic benefits, which means fixing us inside, whether we carry a lot of extra weight or a little bit of extra weight. And we're going to see them having really important benefits for many different diseases. The skin, the joints, potentially in the future, Alzheimer's disease. I think the list is endless.
Yeah, I think it's a really exciting advancement in medicine, in healthcare, and for us as dermatologists. So I guess my first question to you, because everyone knows them as GLP-1s, what is a GLP?
That's right. So great question. So the reality is that these are hormones that our body produces in response to food.
Okay, so they're natural.
They're natural. So our body produces certain hormones. They're known as incretin hormones, and we've got them there to help process sugars when we eat food, so carbohydrates, which are broken down into sugars. They're prolific. These hormones work not only in our gut, but they work in our brain as well to tell us that we are full. And so they're also known as satiety drugs. So they tell us that we've had enough to eat, but they have a range of really important metabolic functions. So what we know is that when we eat, some people are very sensitive and they'll feel full really early. And other people, it will take them a little bit longer to feel that sense of fullness, but they also help process sugar, which means insulin is involved, and glucagon as well. So these are the common hormones we're talking about.
Okay. So from what I understand, the natural GLP-1 that we produce after we have a meal actually kind of is metabolized through our body really, really quickly. But when we have them in these injectable forms, it possibly lasts a fair bit longer and reaches other parts of our body, which is where these positive benefits are being seen.
That's right. So first of all, there are not just one hormone. So GLP-1 stands for glucagon-like peptide 1.
Okay.
The reality is that these medications aren't new. We've had them for approximately 15 to 20 years in Australia.
Okay.
Saxenda or liraglutide was one of the first agents that we've had. But from approximately 2020, we've had semaglutide, which is sold in Australia as two brand names, Ozempic or Wegovy. Ozempic was traditionally used for patients with type 2 diabetes and still is, whereas Wegovy was designed for patients who are looking to lose weight alone. We now have tirzepatide, but it's got two different agonists in it, and that's known as tirzepatide or sold as Mounjaro. And on the horizon, there's even a third one called retatrutide, which is not currently commercially available in Australia. It's not TGA listed or PBS approved. Unfortunately, we know that there are these black market sources of it, and who knows what is actually in those.
So from what I understand, no medication is without side effects. They all do have their own set of side effects, but generally the tirzepatide or Mounjaro is a little bit better tolerated generally than the Ozempic or the Wegovy.
Correct, yeah. So the side effect profile, according to the clinical trials, is slightly less.
Okay.
If we go back a step, why do we even use these medications and what do they actually do? Well, we know that they have a very important role in insulin, and insulin is being proven to be very pro-inflammatory. So it can make a lot of skin diseases worse.
Okay.
It can make a lot of joint diseases, gut diseases, and the list goes on. So this is why we're so interested.
Yeah, so that was going to be my next question. We're dermatologists. Why are we specifically talking about diabetes and insulin resistance and weight loss? There's a whole stack of conditions that we see associated with obesity and metabolic syndrome, of which diabetes is a component. So when someone comes into you to see you in your practice, when do you start ticking over that maybe this medication might be benefits for someone? What are they coming to see you about in the first place?
Really good question. So the common conditions we as dermatologists will see for which these are relevant include psoriasis, hidradenitis suppurativa, acne, hair loss, particularly patterned hair loss, so male or female pattern hair loss.
That's interesting.
Yeah, exactly.
Okay.
We're learning so much more about it. But really, any skin condition that someone presents with who may carry excess weight, who may be obese, is going to be affected in terms of what drug that we can offer them, what medications, how effective they're going to be, and their response to them.
Okay, so that is, I actually find that really helpful as a dermatologist, because in the past we have always known that people that have obesity or are overweight, their psoriasis is worse. And there's been head-to-head studies where people have been compared with a medication versus a medication and weight loss. And the medication and weight loss patients always do better.
Absolutely.
But I find it really difficult when patients come in to see me and I can see that they're overweight, but it's always been a really difficult subject to tackle. So I guess I'm feeling a lot more confident to be able to discuss inflammation with them, that the inflammatory driver, that is one component of their psoriasis, we can maybe better manage with medical intervention.
I totally agree. And I think it's about removing the stigma, the self-loathing, the judgment that a lot of our patients suffer when they do carry excess weight or if they are morbidly obese. Because for many of these patients, I describe it as being genetically hardwired to carry a lot of excess weight. And a lot of these patients have carried excess weight from a very young age.
Yeah, so it becomes quite cyclical. Like, it's very difficult to say to someone that is carrying a lot of weight, that has really bad joint pain, that has that sense of body shaming. Oh, you just need to go to the gym. You need to go to the pool. You need to get out and walking. Like, that's a much bigger hurdle than just popping on some trainers and going out and doing it. So I think helping that first step, because this isn't a short fix, a quick fix, helping them with that first step maybe gives them the confidence to be able to start moving, takes a bit of weight off their joints, makes them feel more comfortable to do that. And then we see that flow-on effect.
Absolutely. And I think we can understand these patients a lot better because when we can first address some of the factors that contribute to their psoriasis or to their hidradenitis suppurativa, and we explain to them that they carry a whole lot of excess weight that's driving inflammation, they start to understand themselves and their disease better, and we give them control.
Yes.
The truth is that these medications aren't magic, right? They're not a silver bullet or a quick fix.
Yeah, so someone's not coming in with psoriasis and you're like, here, have the skinny pen, you're going to get better.
No.
That's not the solution.
Absolutely not. And I think we really need to shift the conversation away from just weight loss to being about metabolic health.
Great.
And to explain that it's not just the medication, it's in conjunction with a really good diet, which I really am keen to talk about, and a good exercise program. But as you mentioned, for some people, the exercise program can't physically happen from the very start because of their extreme joint pain or because of their size.
Okay, so most people are familiar with psoriasis. I just want you to give me like 2 sentences for hidradenitis suppurativa because we've brought it up a few times. It's a really difficult subject to discuss, and a lot of people aren't even aware it exists.
So true. So HS is one of those conditions that's often not even talked about. People have never heard of it. Hidradenitis suppurativa, it's a mouthful. Essentially, it's when patients develop boils in the worst possible places. Under armpits, in the groin, around their back passage, under the breasts. It actually can occur anywhere on the body. And it makes them feel awful. It's painful. Sometimes these boils break open and they discharge and it's quite smelly. And it often can linger for 7 to 10 years before these poor patients actually get a diagnosis.
Okay, so that is just such a difficult condition to manage in the first place. And I can only imagine having that condition and deciding to go for a run. I imagine sweat and occlusion, things like that makes it worse. So this just empowers our patients a little bit further, one step in the management plan. As you said, it's not the overriding cure, but we're just managing one of those triggers that's worsening this condition.
Absolutely.
So lots of inflammatory conditions it can help with, but you mentioned hair loss?
Yeah. So
okay.
It's an interesting one, but what we know is that conditions such as male pattern hair loss or female pattern hair loss, which fall under the umbrella of androgenetic alopecia,
yes,
is driven by androgens, right? So they're male hormones. But we know that a lot of our sebaceous glands and our hair follicles actually have receptors on them that respond to insulin.
Okay.
So we're probably going to see over the next 5 to 10, 15 years that, in fact, many people who have the genes for male pattern hair loss or female pattern hair loss may have an accelerated course if they have a lot of insulin in their body, so if they're insulin resistant, which we know ties into weight and obesity as well.
As we kind of touched on before, this isn't a silver bullet. It's not a cure. Every medication that anyone ingests ever has a side effect.
Absolutely.
So, I mean, it's a needle. It might hurt.
Yep.
You might get a little bleeding or you might get a bruise. So that's really basic side effects. But what other kind of things might people notice if they're taking these medications?
Yeah. So actually one of the most common side effects of the GLP, GIP group is fatigue. People just feel really tired.
Okay.
Right? And why? Because they're probably not consuming as many calories day to day as they're used to. That just lowers our energy. Nausea, so that sick feeling, and vomiting is probably the next group. Vomiting is not common, but it may happen with an increased dose, but that nauseous feeling. Because at the end of the day, the way these medications work is they slow the movement of food through our gut.
Yes.
They give us that full feeling. And as you and I know, if you've had too much to eat, you sort of feel a little bit sick. It's like having that feeling, but on a regular basis. So it's not particularly nice, although it can reduce with time.
Have you heard of sulfur burps?
I have heard of sulfur burps.
So that's probably one of the more unpleasant side effects. But I think, again, that's just due to the food kind of sitting and being static in the gut, and it ferments and you get these kind of fairly nasty sulfur burps. But from what I understand, they settle down after a few weeks.
That's right.
Hopefully.
So they should. The other side effects to know about include constipation or for some people, diarrhea, which can be quite awful.
Yeah, because we're just changing the movement in the gut.
That's it. So it's really important for these patients to drink lots of water, particularly with electrolytes, to ensure that the bowel movement happens regularly and they don't get too constipated. But some of the more serious side effects can be acute pancreatitis, so inflammation of the pancreas. Not common, but definitely can occur. And that can be quite serious. So acute abdominal pain, a really sore stomach, severe vomiting, you'd stop the medication and see your healthcare professional.
Okay. All right. Well, that's really interesting. There's also a term that has been coined when people lose a lot of fat quite quickly, and it's been referred to as Ozempic face.
That's right. Ozempic face.
The dreaded Ozempic face.
Ozempic butt even.
Ozempic butt.
There's a few of them. And it all relates to the fact that whenever someone loses weight, whether you're on a medication or not, that fat that we lose will change naturally the shape of our face. And I use the example of a balloon, right? So if you've got a balloon that's really inflated quite high, you're going to have really firm, a firm balloon and firm skin. If you then lose some of that air, naturally you get that slight crinkling, and that occurs to the skin, and not only the skin on our face, but on the skin on our body as well.
If you lose weight more slowly as opposed to that really rapid thing, do you think you could maybe deter that somewhat?
Quite possibly. That slow and steady weight loss is actually essential, and that's what we should be recommending and aiming for. Like anything in life, you need to be doing things in moderation. And one of the things I tell my patients is it's not about rapid weight loss. I think that's actually potentially dangerous. In fact, one of the things that can happen if you do lose too much weight too quickly is gallstones, right? And then you'll need surgery. You might get cholecystitis or an inflamed gallbladder. So we don't want rapid weight loss. And as you and I know, hair loss is often the result.
One of the biggest things that people come in to talk to me about, they say, I've been on Ozempic, I've been on Mounjaro, I've stabilized in my weight like 3-6 months ago, but now my hair is all falling out.
So common.
Is it going to settle down? Like, is it going to stop?
So we call this process Telogen Effluvium, or TE, and it will happen whenever the body's under stress. Now, weight loss for a lot of these people will be perceived by the body as a stressful thing.
Well, it's most people losing like 10, 15, 20% of their body mass index, and that's a pretty big stressor on your body. It's all of a sudden reconstituting everything that it knows.
Totally. And it doesn't mean to be that way. So what happens is all the hairs that they might have been growing in that time go into a resting phase, known as the telogen phase. Then 3 to 6 months later, those hairs all fall out pretty synchronously, and you can have quite a major shed.
Yes.
Now, when someone stabilizes their body weight, theoretically, that shed should stop.
Okay.
But what happens for a lot of patients is it unmasks their genes for male or female pattern hair loss.
Well, hopefully we're on the pen and we're helping the hair loss. But
well,
yes,
maybe.
this is a much bigger deep dive that we could take into about telogen effluvium and female and male pattern hair loss. But I guess the key factor is most people, the hair loss slows down once your weight has stabilized. If it doesn't slow down, then maybe it's time to check in with your friendly GP or dermatologist to make sure that there's nothing else going on in the background.
Absolutely.
Fact or fad, the Ozempic edition. Ozempic directly destroys collagen in the face, which is the main cause of Ozempic face.
Fad.
Taking a GLP-1 medication can trigger a massive sudden hair loss.
Fact.
Ozempic can actually clear up severe inflammatory acne and conditions like hidradenitis suppurativa.
Fact and fad.
The skin sagging caused by rapid weight loss can be completely reversed with targeted topical firming creams.
Definite fad.
Being on Ozempic makes your skin significantly more sensitive to the sun and prone to melasma.
Fad.
Drinking a liquid collagen supplement while on weight loss medication will prevent facial volume loss.
Fad. So if you found anything we've discussed today helpful, interesting, or informative, just hit subscribe and we'll catch you for our next one.